So, what are the potential safety concerns associated with informatics? Unfortunately, it is not uncommon to see medical errors frequently occurring. This is due to the complexity of healthcare managing and its integration. Unfortunately, there are many isolated systems with little standardization and safeguards to ensure patient privacy and patient safety. Reasons that put patient safety at risk are overwhelming amounts of information, rapid growth in new pharmacotherapies and technologies, increasing time constraints on providers, pressure to reduce costs, and subpar systems for delivering care. Why do errors in informatics occur? The journal article discussed by Orts, Meyer, and Burston quotes that Dr. Clement McDonald, a leader in clinical informatics, states that humans are inherently fallible information processors. This means errors occur because we as humans will make mistakes, and this is inevitable. Unfortunately, we are relying on human imperfection and memory processing and decision making for medical care. This leads to increased rates of medical errors and compromised patient safety. Most errors occur because of faulty system designs. To be effective and efficient, systems need to be redesigned to minimize the probability of human error. One of the most major errors in the medical field, which can be related to human error, is medication administration, which Kyle will be discussing the importance of barcoding when doing medication administration. We know that this is essential because it has been drilled into us since fundamentals, for good reason. Human error is inevitable, and there are more adverse interactions with medications and polypharmacy for one person to be able to memorize all these interactions. A study conducted at LDS Hospital in Salt Lake City, Utah, evaluated the effectiveness of their physician order entry and how it reduced the incidence of adverse drug events related to antibiotic administration. Throughout their study, they were able to evaluate they had an overall reduction by 75% in medication errors, as well as avoiding potential allergy reactions by evaluating and implementing an efficient and effective CPOE system. Unfortunately, in my own work, I also get to see how faulty systems have an impact directly on patient care. I work in a private practice neurosurgeon's office, and we are often having issues within outside integration and inside integration of systems. Our primary issue is with pulling up radiology imaging. It's great for us when patients are using the big three hospitals, McLaren, Genesis, and Hurley. We have no problem pulling up the Flint location's images in our office for our patients. One big issue comes when patients decide to have their films done at any smaller facility or even a facility of these hospitals outside of the area. The big one being patients that are from Lapeer. Unfortunately, McLaren Lapeer and McLaren Flint do not run the same PACS system. PACS system is the way that we are able to pull up the images to view in the office. Knowing that these systems aren't integrated, we do try and we do alert our patients that they do need to bring a CD of these images so that we can provide care. Unfortunately, as discussed before, human error is inevitable, and many patients forget to bring these CDs from outside facilities. What happens then is that we are unable to access their images, and we are unable to see the patient for the day because we do need to see the images to diagnose and treat their problem. Like I said, that is an outside scope of not being integrated. It's many facilities not being able to access at home. Clearly, the outside facilities have their own issues of not being integrated. What is even more surprising is when one facility isn't integrated within its own practice. For my example, I'm going to use McLaren. We can pull up the images of McLaren done in any McLaren Flint facility, but we are not able to access the images done at McLaren Lapeer. This is an integration issue where many of our patients do come from this area, and you would expect that the facilities should be integrated. Unfortunately, as I said, when we aren't able to access these images, we do have to cancel appointments, and this is slowing down the care for patients that are usually most often in pain. This disparity really is unfortunate for the patients. What are potential resolutions to this problem? The first and obvious one for me is that individual information systems and users need to assess and evaluate the efficiency of their systems. Unfortunately, without full integration, there is the possibility for informational gaps. One solution that is being discussed in the long term are something called smart cards. Smart cards would be an electronic device the size of a credit card that patients can store in their wallet, and this would hold their medical information on a microchip. These would work similar to an ATM card that allows consumers to access their banking services, but this would be for accessing their own personal medical information. The potential benefit of a system like this would be that the patient would always keep this on them. Granted, sometimes people do forget, but as long as they have it, they would have access to it. Most people do remember to bring a driver's license and an insurance card to medical appointments, so this would just be a third card they need to bring with them. And this would be so beneficial because on this card it could store your medication list, your diseases, your personal history, anything of essential medical data that offices usually need to have anyways. The other benefit to the smart card system would be that it could keep all essential studies in one place as well, including labs, imaging, and blood work. This would be great because it would reduce costs and reduce the need for unnecessary duplicated services. One problem I also see in my work is many offices tell patients that, oh, we are sending all your information to this doctor's office. This includes imaging reports. When patients hear this, they think that we're going to have access to their images, but the unfortunate truth is we only have the printed report from the radiologist. A card system like this would completely eliminate this because the patient would be holding on to their own images to bring to their office appointment with them. Although this type of technology is still in development and has not been utilized or evaluated to a significant degree in a clinical setting, I do believe that it could be a very beneficial thing to discuss in the future.